Hello, my name is Elizabeth Reynolds. I'm a clinical psychologist and director of pediatric medical psychology within the Division of Child and Adolescent Psychiatry at Johns Hopkins. It is my pleasure to share about our interdisciplinary work on our pediatric psychiatry inpatient service, supporting milieu staff on implementing positive behavioral interventions and supports, which I will now refer to as PBIS. This work was recently presented at the Association for Behavioral and Cognitive Therapies Conference in a symposium focused on integrating evidence-based practices within inpatient psychiatric units. Pediatric psychiatric inpatient care is a type of treatment for children and adolescents with emotional and behavioral issues in a secure environment. The goal of inpatient treatment is to support safety and relieve symptoms. PBIS is a behavioral intervention framework focused on identifying, teaching, and reinforcing positive behaviors while addressing problematic behaviors. In this presentation, we shared how the implementation of PBIS on our pediatric psychiatry inpatient service has resulted in meaningful reductions in the use of restrictive interventions, including seclusion, restraint, and PRN medications for agitation and aggression. A key component for success with PBIS is supporting staff through training, fidelity monitoring, and recognition. Focusing on fidelity monitoring, we developed an observation system approach as a key tool to assess impact of milieu staff training and fidelity. The observations assess key mechanisms of change, ratio of positive to corrective milieu staff to patient interactions, and the use of the reinforcement system. Observations are conducted in 10-minute increments routinely during inpatient treatment, and results are presented to staff regularly for a feedback loop. Data collected in observations showed meaningful changes in the ratio of positive to corrective interactions between milieu staff and patients. Post-intervention, staff members exceeded the goal of at least 5 positive interactions to 1 corrective interaction with patients. Furthermore, staff members largely adhered to positive reinforcement guidelines, that is, providing contingent labeled praise within 1 to 2 seconds of adaptive behavior. Implementation of evidence-based practices in pediatric inpatient psychiatric units requires thoughtful engagement and ongoing support of staff. The described approach provides a means of producing evidence of intended behavior management skills, and also provides an opportunity for feedback to staff about their strengths and potential areas of improvement. This observation method serves as a means to support milieu staff in delivering high-quality care on a pediatric inpatient psychiatric unit. Our child and adolescent psychiatry team is eager to continue to innovate to provide safe, high-quality care. Thank you.